My name is Dr. Michael King. I am the Chief of Staff at PetVet Animal Hospital. And today you're going to follow me around and we're going to just show you what a day in the life of a general practitioner looks like. Hello, how are you? So this is Maple, my first patient that is here for an issue with the left eye being swollen and squinting that started last night. So we're going to take a look at her eye. Any chance of any trauma or anything to the eye?
I don't think so. I thought she went got bit by something. But...
So I'm looking at Maple and I want to try to rule out whether there is inflammation occurring in the anterior chamber or if there's actually been damage to the cornea. We should check the eye pressures as well. Just because when the pupil's really constricted like this and they're squinting a lot, it can indicate inflammation in the front chamber of the eye. So we'll check pressure and we'll stain to make sure there's not an ulcer. Okay. So these are numbing drops because we're going to use this instrument that I have to kind of tap onto her cornea to measure the pressures. So we'll start with your good eye, okay? So this instrument is measuring the pressure inside the front chamber of the eye, and we know what that normal should be, and so we're checking to make sure that they're either not too high or too low. 21, 26. Okay, so those are normal readings. And pressures are normal in both. So because of that, I then moved on to staining the cornea to look for other causes of the eye redness and the squinting. So this is a fluorescein strip. So this is a dye that will stick to the cornea if there's any damage to the cornea. The stain will adhere to parts of the cornea that have been damaged in any way. And so we can look with a black light at the stain on the eye after it's been adhered, and it will stick and not rinse off if there's an area of the cornea that's damaged. And in her case, on the left eye, there were 2 spots where there were corneal ulcers, meaning abrasions in the cornea, that it's healed. Usually this level of injury will heal in a week with medication.
I feel actually relieved that it's not a major problem and that it's probably she got bumped in her eye or something and that it should be taken care of in a week. So I feel a lot more relieved now than I did this morning. Thanks to PetVet.
You're the best patient. Just like so calm and compliant. And Maple will be wearing a cone of shame for the week because we don't want her rubbing at the eye while it's healing. I'll go get stuff made up for her, okay? Thank you. All right, you're welcome. This is a fairly common condition, so if your dog is ever squinting or having a watery eye for any prolonged period of time, say longer than a day, then it's good to bring them in so that we can do some testing on the eye to make sure there's just an ulcer versus dogs can also develop glaucoma and other inflammatory eye diseases.
Don't go anywhere. More of the day in the life at PetVet Animal Hospital coming up right after these messages.
My next patient is Wendy. Hi, how are you? She is a 8-year-old Australian cattle dog that's here primarily for wellness, so getting vaccines updated and getting heartworm tests, but the owner is also interested in having an anesthetic dental cleaning. Yeah, she does need a cleaning. She has a pretty heavy calculus. So Wendy has a lot of debris in the right ear and inflammation when I scoped the ear. So we are running what is called an ear cytology, where we make a slide of the debris that's in the ear and look at it under the microscope to see what types of organisms are there. In most dogs it'll be yeast or bacteria or a combination of the two, and that will just help us determine what medication is going to most effectively treat the ear. And then she also wants to get her ready to have an anesthetic dental cleaning, so we're doing some blood work to make sure that she is okay for anesthesia to do the cleaning. While we're waiting Wendy's lab results, we're going to go in with our next patient, Teddy. He's a 23-week-old mixed breed Tibetan Spaniel Bull Terrier mix. Hi. Well, it's so good to see you so enthusiastic. He is here just for his last round of puppy vaccines so that he can be free to go out into the world and not have to worry about getting parvo or distemper or lepto.
This is Teddy. Picked him up from the Humane Society. He came in today for his last shot. Right now, shot, he has to wait 1 more week since getting that last shot. Then he can get out there and play with other dogs and go and traverse the whole neighborhood.
And then now you're all set now for a good year, okay? All right, you're welcome. If you head up, we'll bring the prescription out for you, okay? Have a good day. I'm about to head in to talk to Wendy's mom again because we have the results of the ear cytology, so we can tell her about what kind of medication we need. She ended up having a bacterial infection in both ears. The right ear was a little more severe. So she's being sent home with antibiotic drops that the owner's gonna put in, and then she's gonna come back in a week so we can just confirm that the infection is gone. My next patient is Jerry. Hello. How are you? Jerry is a 9-year-old feline. The owner noticing that he just seemed like he wasn't eating as well as usual and a little bit lethargic, and she just picked up on some subtle cues. Blood work was fine, but on his x-rays I noticed that there was what looked like kind of a mass in his abdomen. So these were the x-rays we took on him when he initially came in for not eating well. And what we noticed initially was this area here. This is not a structure that would normally be present in a cat abdomen. So we elected to perform a splenectomy, which is basically removing the entire spleen and having it sent in for a biopsy. Oh, it looks great. Yeah. Just a little crusty on it, but he's not, if he licks this now at this point, he won't hurt anything. He can be without the cone. He can be free roaming. Good job, you. He's just like, I'm just gonna lay here like a dead bug. The spleen biopsy was done by a pathologist, and it did come back as a benign type of hyperplasia, but it was at risk for potentially rupturing and bleeding into the abdomen, which could have been a life-threatening complication. Yeah, thank you. I appreciate it. Oh, yes. Cookies and lunch, all right, I'll take it. One of the benefits of having really nice clients.
Don't go anywhere. More of Dr. King at the PetVet Animal Hospital coming up right after these messages.
So our next appointment is Sandy. So this is Sandy. All right, so you found her in a box?
No. Next to a box.
Next to a box. Sandy is a new patient for PetVet Animal Hospital. She was a found animal, so they're estimating her age at 2 years, but we'll take a look at her and see if we can confirm. Doesn't look like she came from the streets.
No.
And then they want to have her checked over and look to see if she has a microchip so they can see if she has an owner already. And then if there is no owner, these people would like to keep her as their pet.
So I have a good girlfriend of mine who was walking, and she happened to see her down between a wall near a new construction zone and a wall that goes to a street. And it looked like she had been dumped. So she called me because I'm an animal lover, and we immediately got into the car and drove there.
And my dad, since he has a limit, no more pets in the house, he ran after my mom's car.
And we said bye, but anyway. We used our flashlights to find her.
She was just like frozen. She didn't even unbend any legs. She was just in so much distress.
Each and every toe line, she had spurs all over it. I'm pretty sure it was really uncomfortable.
Yeah. So then we picked her up in a towel, took her back to our house, and clipped her, brushed her as best we could, bathed her. We were bathing her. That's when we noticed she had lots of fleas on her face. So it was 11:30 at night. We went to Walmart, got flea bath, got flea ointment, and came back, bathed her again. And now here we are.
We're going to be doing her canine 1, so heartworm test, which is a quick blood draw, and then vaccination, so distemper, parvo, lepto, and then oral bordetella, which they will get boosted in about 3 to 4 weeks. Okay, so this is our microchip scanner. So I'm just going to turn it on. You want to smell? We will scan her whole body. Sometimes the microchip can travel from the initial injection. So far, I'm not seeing anything. So she has no chip? Yeah. So she doesn't want anyone. It's a keepy.
Okay, well, we just got her first round of vaccines and some tests done, but all clear, hopefully. So you guys can come home with us. right?
And she gets to, and hopefully she gets to stay with us forever.
Hi, how's it going? All right. Oh my God, so tiny. All right, we got puppy here today, yeah? All right, let me go ahead and do a physical exam. So we're just about to see an 8-week-old toy poodle here for his first vaccines. So we're gonna give the December Parvo combo vaccine today. Perfect, all right, heart sounds good, lung sounds clear. All right, eyes look nice and clear. All right, got baby teethers. Testicles, I can feel 1 so far. So look at the belly button, looks good. Good job, bub. All right, so we're gonna go ahead and get the vaccine, okay? So I'm gonna try to distract with some food. What do you think? But I use a tiny needle, okay? So I'm just gonna go ahead, find the skin. All right, 1, 2, 3, poking. All right, gonna give. Good job, baby. You did so good, buddy. All right, yeah, no problem. You guys take care, okay? All right, super cute.
Hello, buddy. How are you? Hey, how are you? All right, so up next we have Kaido. Kaido is a 4-year-old male-neutered Rottweiler that's here for a rash on the left side of his face and on his neck. The owner reports they've been trying to treat with medicated shampoo, but it hasn't been getting better. We'll make medicating it easier. Oh, hi. Oh, hello. He is the nicest Rottweiler I've ever met. All right, so then we'll borrow him real quick so that they can shave that. Can we shave your face here, buddy? It's gonna be really noisy, I'm sorry. Good boy, it's okay. All right, chlorhexidine solution, which is just like a gentle antiseptic. That's the closest I will ever get to a Rottweiler's face, unmuzzled. So we've got the area shaved and cleaned up. So now that will just allow it to heal better without all the hair covering all the crust. And then we'll get him on some antibiotics so that the skin can heal a little better and have some air.
The doctor is going to give us some oral antibiotics and to treat the area. And so we'll do that for a week and should clear up by then.
So our next patient is Charlie Reyes. He is 9-year-old Labrador mix, and he's here because he has a very swollen left ear, otherwise known as an oral hematoma. So a lot of times when you get a big swollen ear like this, it's from a dog having an ear infection and they're shaking their head a lot and they whack it on something and then it fills up with blood. We have to rule out infection as a cause. It sounds like the cause is actually another dog harassing him at home, but we just want to make sure. But the ears are quite clean, but we'll just double check. The ear has a lot of cartilage in it, so it doesn't have really good recirculation, so blood tends to just pool in there and it'll sit there for weeks and weeks and slowly reabsorb. But when it's this large, we usually surgically repair it because it's pretty uncomfortable to walk around with. So this client has elected to be seen curbside, which is kind of a holdover from the days of COVID. So these when they get really big like this, they don't heal very well on their own.
We brought Charlie here because he had an infection in his ears.
I just spoke to Charlie's owner and we discussed different ways to approach this ear hematoma, and he wants us to proceed with a technique where we place a cannula in the ear that will allow them to actively drain the ear at home. So while Charlie is waiting for sedation so we can do his procedure, we're gonna move on to Bubbles. Gonna take a look at Bubbles. Hi, Bubbles. Goodness. You look very stressed out with your red eyes. She is an almost 9-year-old female spayed English bulldog that's here for an issue with her anal glands and to get her ears checked. And I do see there's stuff coming out of it right now.
The reason why we brought Bubbles in is because she was suffering from some discharge coming out from her back end.
So for Bubbles, ultimately, after discussing things with the client, with this constant chronic drainage out of her anal sac, we elected to do what is called an aerobic culture, where the lab will grow out the bacteria and tell us what antibiotics will be effective against the infection.
Now that the doctor has found out what the problem is, we're going to go according to the regimen that he set and to find out what the results are from the culture, and we're going to attack the problem from there.
Charlie, sit. All right, or you can stand while Auntie Elaine pokes you if you want. Good boy, Charlie. Just a quick poke and a little nap, okay? First, we're gonna just shave the ear. He's a little itchy. See, he feels that a little bit. The ears are real sensitive, so even under sedation, a lot of times they will react a little bit. So this is a pinnipedal reflex, this is called. So when you do stuff to their ear, their back leg will have a reflex arc. So we're gonna make a little nick in the skin. We don't want too big of a hole, but it's gonna bleed a lot. So we're gonna drain, and then we're gonna wedge this cannula in there, which will be our drain. Hopefully the outcome of this is over the next couple of weeks, we'll allow it to continue to drain. Usually we leave it in for about 2 weeks total. And then as long as the ear has completely sealed back together, then we just pull it out and let the hole heal by itself. And he will be back to his normal self. At PetVet Animal Hospital, we have broadened our array of surgical options with new doctors that have come on board. So not only do we offer routine spays and neuters and dental prophylactic procedures, but we also offer more advanced soft tissue surgeries, including upper airway surgeries on our brachycephalic breeds like French Bulldogs and English Bulldogs, including knee surgeries on smaller breed dogs that have cruciate injuries, along with mass removals, foreign body surgeries, any number of other soft tissue surgeries. So please take a look at our website to see if we have what you are looking for. So that wraps up our day today. So this gives you an idea of the average day of a veterinarian. You can see a large multitude of different cases, from doing just outpatient procedures to actual sedated procedures. It's a very exciting day, and thanks for joining us.